Shock happens when not enough oxygenated blood is provided for every body part. Because every injury affects the circulatory system to some degree, you should automatically treat injured victims for shock. Do not wait for signs and symptoms of shock to appear before treating it.
To understand shock, think of the circulatory system as having three components: a working pump, the heart, a network of pipes, the blood vessels, and an adequate amount of fluid, the blood. Damage to any of these components can deprive parts of the body and produce the condition known as shock.
Shock can be classified as one of three types according to which component failed. Pump failure, when the heart does not pump sufficient amounts of blood. For example, the heart during a cardiac arrest cannot push blood through the blood vessels. Fluid loss, when a significant amount of fluid is lost. Besides blood, other body fluid losses due to vomiting, diarrhea, diabetes, and insufficient fluid intake can result in a sizable amount of fluid loss. Pipe failure, when the blood vessels or pipes enlarge and there is not enough blood to fill the blood vessels. This happens in a spinal cord injury or severe allergic reaction.
A person in shock will have anxiety and restlessness, pale lips and pale, cold, and clammy skin, rapid breathing, a rapid pulse.
To care for shock, treat any immediate life-threatening conditions. Lay the victim down. If alert, place the victim on their back. If unresponsive or vomiting, place the victim in the recovery position. Raise the responsive victim's legs about 8 to 12 inches. Raising the legs helps drain blood from the legs back to the heart. Prevent heat loss by placing blankets under and over the victim.
Anaphylaxis is a type of shock. It is a severe allergic reaction to substances often eaten or injected. Anaphylaxis is life-threatening and requires immediate medical attention.
Causes of anaphylaxis include medications, foods such as peanuts or shellfish, insect stings, and radiographic dyes.
Anaphylaxis usually comes on within minutes after exposure to the offending substance. Signs and symptoms of anaphylaxis include sneezing, coughing, wheezing, shortness of breath, tightness in the chest or throat, swelling of the mucous membranes including the tongue, mouth, and nose.
To provide care for anaphylaxis, check the ABCs. Seek immediate medical attention. If the victim has his own physician-prescribed epinephrine, help the victim use it.
The average adult has about 5 to 6 quarts or 10 to 12 pints of blood. Quickly losing 1 quart or more can be life-threatening. Regardless of the type of bleeding, your primary care is to control the bleeding.
To care for external bleeding, take precautions to prevent disease transmission. Expose the wound. With a sterile gauze pad or a clean cloth, cover the wound. Apply pressure with your fingers or the palm of your hand to control the bleeding. To free you to care for other injuries or victims, use a pressure bandage to hold the dressing on the wound. Wrap a roller gauze bandage snugly over the dressing. Do not apply it so tight that it cuts off circulation.